All right, let's go ahead and get started. It is about 3:30 p.m. Tuesday, August 22nd. Thank you everyone for joining today's session. Today's session is on comparing your plan options and how to use your PPO. I want to let everyone know that today's session will be recorded. So if for whatever reason you have to leave the session early or you just feel like you need a recap of this information, it will be recorded and be available to you. My name is Asia Simpson. I am your wellness and benefits consultant. I support your wonderful, wonderful benefits specialist, Mindy Hunt, who is on today's call as well. Before we get everything started, I wanted to just hand it over to Mindy in case you had any quick announcements before we got started that you wanted to make sure everyone was aware of.
Hi, Asia. Hi, everyone. Thanks, Asia, for coming and doing this again today. I'm taking appointments, so there's a link under my name and my email if you have an email from me, or just send me an email so you can get a link to meet. Also want to remind you that next Tuesday is our flu clinic health fair. And so even if you're not getting a flu shot, you can come and someone from CVT and Blue Shield will be there. CVT can help you with enrollment or any questions you have about open enrollment. So I welcome all of you to come to that and get some goodies and meet a few people and get your flu shots. If you haven't signed up for that, any questions at all, just let me know. Thanks, Asia.
No problem. And I just want to remind everyone to, as an additional incentive on top of the wonderful vendors being there and it being a health fair, there will be raffle prizes as well. So one that I know for a fact that myself, I will be there and I will be providing. So please make sure you guys come on out. If there's someone that you know of who is not on today's call, please make sure you let them know, share the word that Tuesday of next week will be it's the health fair and it's the health fair, right? An open enrollment fair, correct?
Yeah, health fair, flu clinic,
Flu
and their
clinic.
vendors. It's from 2 to 5. There'll be some refreshments as well. So yeah, I hope all of you can come and check it out.
Wonderful, wonderful, wonderful. Well, I hope I get to see you guys there. So without further ado, I'm sure you guys, for some of you who have attended the sessions that I've done in the past, you may have seen this content. But today we're going to share it again and provide just some updated information and also provide a little bit of information around a particular plan called the Wellness PPO. Some of you may be familiar with it, some of you may not. And so I just want to share a little bit more information about it just so that you are aware really what the difference between that particular plan is and some of the other plan options. I'm going to start off with sharing my screen, and if you would be so kind as to any one of you, if you can give me a thumbs up or take yourself off mute and just let me know that you can actually see my screen. I want to make sure everyone can see my screen.
I can see it.
Perfect. All right, so what are we going to cover today? Well, we are actually going to cover what I think is really important, which are some important terms to know. And I think that the terms to know are important because if you ever have questions and you have to contact CVT or you have to contact Blue Shield or you receive any type of notification from your health plan or are talking to your provider's office, there are some common terms that is going to be helpful for you to understand so that it helps you navigate your plan the way that you need to, and so that you understand how things are being processed and how to basically ensure that you're making the most out of your health plan. So we're going to cover those. There won't be a lot of them, but there will be 4 basic terms that I think will be important for you. The next thing we're going to really look at is what are your plan options that are available to you as a Greenfield Union School District employee under CVT. So we're going to go over those. Some of you may already know what they are, but hang tight because I still think it's a good refresher, especially right before you go into open enrollment when you have to make plan elections. You may find that you may want to make some changes to what you currently have. Then we're going to take a look at how they compare because it's important not only to know what the options are, but really how they stack up against each other so that you can understand which one is going to be a best fit for you. And then what I'm going to do is take a minute to go over an example on how to use your PPO. I know that it probably sounds, very self-explanatory for some people, but if you aren't really that clear about the way to navigate your health plan, or really just haven't really understood how your health plan works, which is the vast majority of people, nothing to be ashamed of because this is very complicated. I want to kind of explain to you in the giving year, like how it works so that you have a better understanding. And then I'll talk a little bit about some tips for choosing which plan might be best for you, some questions to ask yourself. And then I'm going to do a little bit of a raffle. So just to kind of kick off open enrollment, we want to kind of get you guys, set up with a raffle prize. So I'll ask you guys a couple questions, and we'll have two raffle winners in today's session. So just make sure you're paying attention. And if I say something that you don't understand, please stop me. Um, and then we'll just take a look at some resources available to you. And if there are any questions left over in the end, then I will go ahead and take care of those. So first things first, important terms to know. So there are four main terms. These are not by far the only terms, but they are, I would say, the most important, I think, as you start really navigating your health plan. And I would say the first term is deductible. And so what a deductible essentially is it is kind of like it's the amount of money that you have to pay before your health plan really kicks in to pay that coinsurance. And we'll talk a little bit about what coinsurance is here in a second. So before they'll pay that coinsurance, you have to pay a set amount based off of which plan you choose. And we're going to connect the dots on the different deductibles versus the different plans in a second here. Copays are something you guys are probably pretty familiar with. It's like that set amount that you pay when you go to see your primary care doctor, or that set amount that you go to pay when you see your specialist. It's usually a smaller amount, like $20, $25. So that's probably what most people are the most familiar with. Now, I mentioned before coinsurance that when I talked about deductible, the deductible is a set amount that you have to pay before the coinsurance is paid. Well, the coinsurance is similar to a copay, but it is the amount that you have to pay for certain services, but it is in the amount of like a percentage as opposed to a set amount. So when you're looking at your your health enrollment booklet that Mindy does, or if you're ever looking at any of the plan side by sides, you'll sometimes see something that says 10% or 90% or 80%. That is the coinsurance. And the way that that is broken down is, let's just say you pick a plan that has a 80-20 split. What that basically means is after you've paid the deductible that is stipulated for the plan that you chose, then the health insurance plan, which is Blue Shield, they'll pay 80% of whatever the cost of that service is, and then you pay the other 20%. Now, when we go over the example of how to use a PPO, I'm actually going to break that out specifically so you can kind of really see what I mean by 80% of what the service is, or 20% of what the service is after you pay the deductible. It may sound a little bit confusing right now, but as we move further in and I show you the example, I'll break it out to you so that you can kind of understand in an example form. And then the last important term is out-of-pocket maximum. And basically that is the maximum amount of money, of your own money, throughout the course of the whole year as you're going to the doctor's office, going to your visits, having procedures done. It's the maximum amount that your plan sets for what you'll have to pay out of pocket for your own care throughout the course of the year. Now, that does apply to in-network procedures, the out-of-pocket maximum does. And we'll look at that on the plan so you can see what that looks like. So 4 terms: deductible, which is the amount of money you have to pay before your coinsurance kicks in. Copay, which you're familiar with, like your $20, $25, $30, what you go to see, you pay to see your doctor. Coinsurance is that percentage, which is similar to a copay, but certain services are a percentage as opposed to a set small fee. And then out-of-pocket maximum, the maximum amount of your own money that you'll pay in a given year for your care, okay? Now, let's see what that looks like. Now, this is how it will look on your actual side by side, like where you'll find this information on your side by side. So if you go into the whole health enrollment guide that Mindy has sent out, or if you don't have it in your email, go to the benefits webpage and you'll see this side by side is in there. It's in with your rates as well. So I mentioned the deductible. So if we take a look at the CBT PPO 6B plan, if we're looking at the deductible, for a single person, the deductible is $250. For family, it's $500. That is the amount of money that you would have to pay before your co-insurance kicks in. Well, let's hop down to the orange area where it says co-insurance. We're talking about services like scans, CTs, CATs, MRIs. What it says is that the co-insurance is 20%, okay? Let's look at non-hospital. So let's just say your doctor you go to see your doctor and they say, you know what, I want to have you do a CT scan. And let's just say the cost of the CT scan is something ridiculous. Let's just say $500 for the sake of example. So your coinsurance in the 6B plan is 20%. What that means is the plan will pay 80%, but they'll pay that 80% after you have paid your deductible. So if the cost of the scan is $500 and you're early in the year, meaning you haven't really gone to the doctor, then you'll have to pay that $250 first. And then after that $250 is paid, then you will pay 20% of whatever's left over, and then the plan will pay the other 80%. If you have to go back and have more scans, you don't have to pay that deductible all over again once you've hit the $250. You would just, at that point, after you've paid it, then you just pay your 20% and the plan would pay the other 80%. And that's how it would go throughout the rest of the year. You only pay your deductible once. Once you've paid it, then you're just doing your split of, in this case for the 6B plan, 20%, okay? In the 5B plan, it's 10%, but the dynamic is the same. Where you would find the copay, if you'll see the small set fees that I was talking about, $20 for office visit, $20 for urgent copay, $20 for specialist visits. Those are probably what most of you are familiar with when we're talking about, all of these terms. And then the out-of-pocket maximum. In the example here of the 6B plan, it is $2,000 for individual and $4,000 for family. So that means, and I'm going to spend a bit more time on this later, that means that throughout the year from January or from whatever your plan starts, the plan year starts to when the plan year ends, and I believe that is October 1 to September 31 of the next year, it is $2,000 that you would pay max out of pocket for services. So if you had a service that cost quite a bit, like say you had a diagnostic x-ray that was, pretty expensive and you had several of those, and it got to a point where you ended up paying out of pocket $2,000 by the end of the year or close to the end of the year. If you hit that $2,000 and you still had additional scans to get, then you wouldn't pay anything else. So we'll talk about that later, okay? So that's where you'd find this information. So when you look at the side by side, I want you to be looking at those things because typically those are what are going to help people with making determinations on what plans can they afford and which ones fit best for them. Okay, so we'll come back to that too. Now, before I move on to what your plan options are, I just want to do a quick check-in with everyone and make sure I didn't lose anybody with talking about the different important terms to know and where to find those those different elements on the side by side. Anybody have any questions so far? Okay, I think I'm doing good. All right, so let's go ahead and move on next to what your actual plan options are. So through Greenfield Union School District, CBT administers the plans, and the plans are done through Blue Shield, and they're all PPO plans. You've got the 2B, which is pretty much like the cream of the crop. You don't really have a co-insurance on that one. The plan pays the co-insurance once you paid your deductible. And then the next two plans or three plans, I should say, have the lowest coinsurance for you, which yours would be the second number. The first number would be what the health insurance plan would pay. So for 5B, 6B, and the wellness plan, it's a 90-10 split, meaning the Blue Shield will pay 90% and you'll pay 10% after you pay your deductible. And then the 8B plan is the 80-20, and the bronze is the 70-30. And I bring that up because when you are making your plan choices, what you'll notice is a correlation between what the cost of your premium is and, what your split is for health insurance. So you'll probably see that this 2B plan will likely be one of the most expensive plans when you're looking at your rate sheet. So I just want you to keep those things in mind. And these plans are based, again, going back to the deductibles are going to vary between the 2B plan to the bronze plan. The 2B plan will likely have the lowest deductible. Again, when you have to pay less out of pocket and the plan is taking on more, the deductible and the cost of the plan will likely be higher. So just think of those things in mind. You'll typically have a cheaper copay. And I mentioned the coinsurance, and especially on the 2B plan, it's nothing. On the 5B, 6B, and the wellness, it's 10%. And the out-of-pocket maximums you will find will be a lot lower with the plans that are going to be more expensive because you are paying more in your premium so that you have to pay less throughout the year. So think of those things. They may help you when you are trying to weigh out which plan options are going to be more feasible to you. Okay. So let's kind of, in summary, because there's a lot of information when you look at the side by sides, and let's kind of stick with those four terms to kind of help us sort through all that information. So side by side, when we're looking at it, I mentioned to you before, the 2B plan has no deductible and it pays 100% of the coinsurance. So when you have those services, like we looked at the previous example, like a CT scan or a PET scan, you will likely not see anything out of pocket for your coinsurance, but it is going to likely be a more expensive plan. And if you notice, the out of pocket max on it is a lot lower than some of the other plans. And when you start looking at well, maybe you can't afford a 2B plan. Maybe you want something that is the next richer plan. And so you can take a look at this slide deck, or this little slide may help you with narrowing it down, especially when you look at the plan side by sides and there's a lot of information and you can kind of get sucked into all the details of it. I would always say, look at something simple like this to kind of help you and your starting point. And then if there are specific services that you know for your family or for yourself, you need to be cognizant of, and you need to know how it stacks up against the other plans, then go from there. But this is a good starting point because it tells you, from a deductible standpoint and what you're going to be paying, just for regular general services, even if you don't have any specialty type of services. Your co-pays are going to be around $30 for the 5B plan, around $20 for the 6B plan. And the wellness plan, I'm going to actually take a second to spend some time on that one here in a minute. But this kind of gives you an idea of how they lay up against each other. And you'll see the plan that has the highest out-of-pocket maximum is going to be the bronze plan. Not really the plan that I suggest for most people because it doesn't provide as much coverage for you as you might potentially need, especially for, unless any of you are, extremely well off. A lot of people can't afford an out-of-pocket max of $6,350. And the deductible is $5,000. So that pretty much means that you'll be paying pretty much everything, going forward, unless you have an extensive amount of services. But if you do want to try to look at a plan that is going to be more affordable, it may have a bit more out of pocket throughout the year, then you want to start looking at your 80-20 splits, because those are going to likely be more affordable, because that means that the plan doesn't pick up quite as much, but they do pick up more than, say, a bronze plan. So I want to mention to you that regardless of which plan you choose, The Affordable Care Act mandates certain services, health services that are free of charge. And that are things like your preventative care visits that you go to see your doctor. So that's kind of like your well visit. For women, there's the well woman visit. Those visits are incorporated into your plan free of charge. So you should not be paying a copay for those types of service. But what I will say in my experience, that when you go to make an appointment with your doctor for your well visit or your annual physical preventative care visit, you really do have to stipulate that with the plan because they do all of their coding and they submit your service, like your visit, to the health plan to be paid. And if they don't code it properly, you could end up having a copay when you really shouldn't. So just keep that in mind as well. Something else to know about all of your plans as part of being under CVT, there are services, they call them value add services that are built into your plan. Metrics is one of them, which they will actually be at the health fair next week. And that is the chiropractic, occupational therapy, physical therapy. Those types of services are built in and attached to your plan. There are other services called like Beacon, and I think Beacon has actually changed the name. And I'll have to look at what the new name is, but it's basically the EAP services. And EAP is a service that I think a lot of people don't take advantage of because it does have things like they provide education, like online workshops we have done in the past. I believe EAP workshops where there's a variety of different topics that you can look at anywhere from um, advanced directive planning to, working through and dealing with stress to workshops and information on if you are an adult caring for an adult parent. There is also services like Alight, which is formerly Consumer Medical. If you have a procedure that your doctor has ordered a treatment regimen that you really don't agree with and you just feel uncomfortable with it, or you maybe not feel uncomfortable with it, but maybe you want to do your due diligence. Alight is a second opinion service that is a benefit that is built into your plan. You can take advantage of that. And so these are all services that are all built into your plan. The participation in the wellness plan, which is this one here in the middle, that one, and we're going to talk about here a little bit more in the next slide, but that is an opportunity to get up to $400 in wellness credits, and it kind of changes what your wellness credits come in the form of each year. I think last year it was Amazon cards. I think previous years it was a credit through Health Comp, and this year I'll show you kind of what that's going to look like for the current year. But the plans are that particular plan is really geared towards ensuring that you take advantage of your regular preventative care type of services or services that will help improve your wellness. Because statistics show that when you are proactive from a wellness standpoint, it does prevent you from having to go to the doctor more often for things that you may not have caught or for lifestyles for which aren't quite as healthy and land you in the hospital or in your doctor's office. So that's what the plans are, the plan options that are available to you through Greenfield Union School District as an employee. And here, like I said, is where I would start because I know that it's a lot of information and this might help simplify your starting point. Before I move on to going into the wellness plan, were there any quick questions that anybody had? I'm going to check the chat box here. Any questions that anyone has about the plan options? Okay. All right. So let's talk a little bit about what the wellness plan is because it is a little different than some of the other plans. It has a added benefit to it. So the overall design and setup of the wellness plan as a PPO, that is the same as the others. But the added benefit to the wellness PPO plan is that CVT has collaborated again this year with Blue Shield to continue to offer you the wellness PPO plan. It allows you to participate in different wellness programs as well as wellness related activities for you this year to earn up to $400 in a redeemable prepaid gift card. So this year is a prepaid gift card, and you must complete at least step one of the required steps. And so what I'm going to actually do right now is I'm actually going to stop share on the presentation because I do want to take a moment to show you what the steps look like, just so that you kind of understand what this looks like. And I'm going to show you the flyer that I'm sure Mindy has available to you and has sent out. So this is what the hopefully you guys can see this. Can everyone see my screen? It should be the earn up to $400 with your CVT Wellness PPO plan. You see that? Can I get someone? Yes, thank you so much. Appreciate it. Thank you for letting me know. All right, so here's kind of how it works. So if you enroll in this particular plan, you will earn your first $200 prepaid gift card by just doing your annual preventative exam and registering and completing an online health assessment. They want you to go to engagement point. I don't know if any of you have participated in the past or attended any of the workshops that Mindy and I so tirelessly had Blue Shield and CBT present. But Engagement Point is an app that kind of pulls all these different value added services, ones that I mentioned in the previous screen, like MD Live and Alight and Beacon and all of that. They pull them together all in one platform, because the reality is that when you have a bunch of different services, while they may be beneficial to you, sometimes it can be overwhelming to kind of try to figure out where everything is. And so one thing that they did was try to put everything together in Engagement Point, one platform for you to be able to go in and be able to access all those resources. And so if you want to take advantage of the CBT Wellness PPO plan and you get your annual preventative care exam, then you would simply end up going into the Engagement Point app and taking the assessment, and boom, you got your first $200 prepaid gift card. Now, in order to get the additional $200, you have to first complete step one, which is your preventative care, and go in and do the assessment. That's number one. So to get the second $200, you can actually do a variety of different things, because some of the steps, some of the things may not apply to you. So this flyer, you can always refer to it. And step one, we just talked about here shortly, just a short moment ago. But the other things that you can do are any combination of these things to get the remaining $200. You can complete your Wellvolution assessment, which Wellvolution is a wellness related health platform that is accessible through Engagement Point, that has a lot of different resources to help with your wellness journey and provide you with access to things like Weight Watchers, Solar for Meat, a bunch of different health related programs. And so if you complete your assessment in Wellvolution, which the assessment really just asks you questions about your health so that they can customize and provide you with information on things that are relevant for you specifically. And you enroll in a program or an app. One of the apps they have in the Wellvolution is Calm. That is an app that provides a lot of different resources: self-guided meditation, music, motivational things. All of those things are kind of built into the Calm app. I use it regularly. So if you complete the Wellvolution assessment, enroll in a wellness program or an app, you get another $100 prepaid gift card. There are other things like mammogram or colorectal screening. Once you do those, you could get $50. Cholesterol screening, you can get another $50. Complete the Engagement Point well-being journey, $50 up to $100 there. Or if you connect a tracking device to Engagement Point, like your Apple Health Kit, your Google Fit, your Fitbit, any of those, and track 10,000 steps a day for 3 days, you'll get a $100 prepaid gift card. So any combination will work. So let's just say you don't you're not going to do the mammogram or the colorectal screening or the cholesterol screening. You could complete your Wellvolution assessment and connect a tracking device, and boom, you've got $200. So it's a combination of those things. It doesn't have to be, the first two or the first, the second three, but it will, once you get to $200, that's what your maximum will be. So you'll get the 200 for your step one, which is required. You can't do any of step two if you don't do step one. Okay. So I just want to kind of mention that to you. This flyer, and we're not going to spend a whole lot of time on it. This flyer kind of shows you visually what setting up your going in and setting up your engagement point and all of that looks like by going into the CVT. Once you get into the CVT wellness plan, you want to go ahead and get everything set up here and register your account. So it shows you step by step how to do that, and then where to go and how to get into engagement point and all of that good stuff. So I would encourage you to take a look at this flyer when you get a chance, if you are considering the wellness PPO plan, because that will be beneficial to you and it will help you understand what you need to do to get your prepaid gift cards. Okay. Any questions on that before we hop into the rest of the remaining content? Okay, perfect. All right, so let's go ahead and get back to the slide deck, and I'm going to reshare the slide deck here. Pick up where we left off. Can I get a thumbs up or you can see my screen from anyone? Perfect. Thanks so much. Appreciate that. All right. So this is not a very good slide. Looking at this on the big screen, you can kind of see it's not very clear. However, this is pretty much a cutout of what is in your health guide. And we kind of looked at this a little bit when we were looking at the 4 terms and where you find it. But I have this just on the screen for illustration purposes to let you know all of the great information that is in your health benefits guided. This side-by-side summary is in there. It also includes information on your pharmacy benefit as well as your dental and vision information. So make sure you check that out, and it will again show you how they compare. This is a lot of information, but so again, I highly encourage you to refer to this slide and kind of start here with the simple information. And then if there are things, again, that are specific to you that you really need to make sure that you keep in mind, like maybe you have specific types of inpatient care services that you need to think about, then go and look at the bigger, more detailed side-by-side comparison. But I do know from my own experience in the past, when I was first understanding how to navigate PPOs, this could be a little bit overwhelming, although it has a lot of great information. Start simple and then kind of use this to kind of help narrow in on what you really need. Okay, question up. Veronica, what is your question?
Okay, yes, I have a question. If I were to change from, what is it? PPO 8B to the PPO Wellness 1, if I already met my deductible for this year, do I have to start all over or I can
That
change?
is such a good question. I am so glad you asked that. That's actually going to be part of our example that we go over here in a second, but I'm going to answer it now because it's such a good question and it is appropriate for now. So your deductible goes from the beginning of your plan year to the end of your plan year. So when, in your case, October 1 of, we're in 23, so October 1 of 2022 to September 30th of 23, if you met the deductible during that period, it will be valid for that period. Starting October 1 of 23, everything restarts all over again.
Okay, so for example, then I'm not gonna have to start all over in January, because my understanding is in January the 1st, 2024, I would start with the new deductible, or no? I just
No,
want to
I
make
think for CVT, the plan year goes from October 1. And Mindy, correct me if I'm wrong. The plan year goes
You are wrong.
Oh,
Sorry.
okay. Well, yes, thank you for saying that.
It is calendar
It's
year.
calendar year. Okay.
So my understanding is that even though they are changing mid plans, they still carry whatever deductible they had. Like if they were in plan 5 and then they switched to plan 8, whatever deductible they had on plan 5 that they use will just go into Plan 8. They don't start all over in October.
Okay, they make it very
Yeah.
complicated, in other words. So Veronica, in answer to your question, yes, if you've met your deductible for this year, it will be good all the way till December 31st of
Okay.
this year. And then your new deductible, if you switch a plan, will begin January 1.
Okay, good.
Okay. So, all right. So I stand corrected. Thank you for saying that, Mindy. So really what changes from October 1 of 1 year and ends on September 30th of the other is just the if there's any plan changes or any differences, which in your case, there hasn't been any. So, all right. So let's talk about so that's actually a perfect caveat. I'm going to come back to our knowledge checkpoint in a second here, because I think it will be helpful for you to understand this example in order to be able to answer any of the knowledge checkpoints. So that was a perfect question that Veronica had as a segue into the actual example. So this is an example of a plan. This is not necessarily representative of any plans that you guys have. It is just a sample example, okay? So let's just say Jane Doe has this health plan, this PPO health plan. Her coverage begins January 1 and ends December 31 of a given year, okay? In this plan, her deductible is $1,500. If you recall, a deductible is the amount that you must pay, or that Jane in this example must pay before her health plan will kick in and pay their part of the coinsurance. In this example, her coinsurance is 20%. So what that means is after she's paid her deductible, her health plan is going to pay 80% of what's left over, and she'll pay 20%. The maximum amount that she's going to have to pay throughout the whole year out of her pocket towards co-pays, co-insurances, all of that good stuff is going to be $500. Okay. So in this example, let's just say Jane Doe goes into the doctor's office at the beginning of the year. So far, she hasn't gone to see the doctor, hasn't paid anything. So she has a service that has to, yes, I will share this presentation just so you guys know. She has a service that costs $125. And because she hasn't met her deductible, the health plan really isn't going to pay anything on that because she hasn't met her deductible. So she would pay the full $125 and her plan wouldn't pay anything in that case. So that's a bummer, but it's beginning of the year, so Jane expected it. So you can kind of see this kind of balancing scale here of who pays what. So let's just say she goes throughout the year, and periodically throughout the year, she is still having to go to the doctor's office and have services where she is paying her part of the services, the co-insurance piece of things. She hadn't yet met the deductible until she gets to the point where she has met the deductible. Okay. So let's backtrack. This $125 that she had to pay, that goes towards the cost of that deductible. So $1,500 minus $125, and then she's going to the doctor, and each and every time she has a service that has a co-insurance, it subtracts off of the total amount that she still has to pay towards the deductible until she gets to the point where she's paid the full $1,500. Okay. Now she's in the middle part of the year, just for example's sake, and she's paid that deductible, and her service is $75 in this case. Well, lucky for her, she has paid her deductible. So in this instance, she will pay only 20% of that $75, and her insurance is going to pay the other 80%. So, and if we do out the math, it's $15 she'd pay, and then the plan's going to pay $60. Okay. All right. So that's great, fine and dandy. Unfortunately, Jane is not having the greatest year ever when it comes to going to see the doctor and having health expenses. And so she finds herself in a situation where she has spent out of pocket $5,000. Now, lo and behold, let's hope that that never happens to you guys. But in this instance, let's just say that she spent $5,000 and it's not even the end of the year yet. She unfortunately ends up having to go to the doctor again, and this time the service is $200. Well, in this example, she has already paid $200. I mean, she has already paid her $5,000. So the service is $200. So she actually doesn't have to pay anything at this point because she's hit her out-of-pocket max. Okay. And the out-of-pocket max in this case was the $5,000. And so the plan's going to pay the full $200 in this example. Okay. So that's kind of how it works. Now, when she gets to the end of the year, and we begin going into the new year, as I mentioned before, everything starts all over again. So if she stays in the same plan where her plan deductible is $1,500, the coinsurance is 20%, and the out-of-pocket max is $5,000, then everything will start all over again. And so her deductible will be refreshed at $1,500. And so she'll have to get back to that amount again before the health plan will pay their 80%. Did that make any sense? Or was there anything that was unclear? Did anyone have any questions specifically on that example?
Just for clarification.
Sure.
So I just want to make sure I'm reading it right.
Sure.
Your plan deductible is $1,500 per year.
In this particular example, yes.
Okay. So that means that the 5,000 is part of this 1,500, or that's
the 1,500 is part of the 5,000. Yes.
Thank
Yep. You got it right. I'm glad you brought that up. The 1,500 is part of the 5,000. Okay. All right. Any other questions? All right, let's see. Do deductibles only happen when you require medical service? So deductibles are required on specific services. And that's where you really want to look at the side-by-side because it'll tell you, let's go back so you can kind of see. It's not that clear, but let's go back here. So if you notice, this isn't the full breakout of it. When you look at your side-by-side, you'll see it. But you'll notice there are certain services that have a flat copay, and there are certain services that have a coinsurance. This part only shows kind of like what's under professional services, where scans, CT, CAT, MRI, those have a coinsurance. But there are additional services that fall under different areas of care that do require a coinsurance. So you can't see this well, and I apologize, and you can probably see it a lot better in your health enrollment guide. But down here under mental health, substance abuse treatment, inpatient facility-based care, there's a 10% 10% coinsurance after your deductible for this CBT 5B plan. Same similar dynamic for the rest of the plans. And you'll see again, surgery, outpatient care under hospital skilled nursing services require a coinsurance. So it's specific services that have a coinsurance where the deductible will come into play. And that deductible will only come into play until you have paid it up. So if you have this 5B plan and your deductible is $100 and you pay it, you don't keep paying a deductible each and every single time. You pay that deductible once in a given plan year, and once you've hit it, then all you're looking at is the coinsurance split. Did that make sense, Eli? Hopefully it did. And if it didn't, please put in the chat box and let me know.
Yes, thank you.
Okay, perfect. All right, so let's go ahead and take a quick look here at our knowledge check. Let's go back to the previous one because now I feel like you guys are in the good place to be able to answer this question. So now knowledge checkpoint. what is the difference between the out-of-pocket maximum and the deductible? Does anyone want to take a stab at this question for a $20 gift card? Go ahead, Veronica.
Okay, the difference between the out-of-pocket maximum deductible, that's the max that you would pay in a full year.
Okay.
And the difference between the co-insurance is that means if you've met your deductible, then that's when they pay the difference between whether it's 10 or 90%.
Yes.
But once you hit your out-of-pocket max, it should cover 100%, right?
Right.
Okay.
Right. Yes. So good job at answering both questions. You're actually an overachiever because you answered 2 questions, but that's okay. I got more questions. So perfect. So good job, Veronica. So yes, out-of-pocket maximum is the maximum amount that you will pay in a given year towards the cost of your medical expenses. I want to make sure I reiterate too that is for in-network services, services that you go to see from doctors that are in your network. That goes into the out-of-pocket maximum bucket. Okay. The deductible, which as Veronica asked before, is the deductible part of the out-of-pocket maximum. It does fill that bucket, and the deductible is the amount you must pay before your insurance plan will pay their split of the co-insurance. Okay. And then the co-payment is the set $20, $30 amount that you guys are probably really familiar with. Okay. All right. So Veronica, if you can make sure you send me a chat, just let me know which email address you would prefer your e-gift card sent to. Please let me know. All right. So one more question. All right. Let's see here. Oh, I jumped the gun here. Okay. All right. So here is the example here. Hopefully you guys didn't see the answer. Let's just say this is one of the examples I did last year. Let's just say the following amounts apply to your plan at the beginning of your plan year. Okay. You need a lot of treatment for a serious condition. Let's just say, let's hope in real life this doesn't happen for you. If the allowable costs are $12,000, what are your total costs for the service? I kind of told it out here. So $3,000 is your deductible. Okay. 20% is your co-insurance. And $6,850 is your out-of-pocket max. So what are your total costs? Knowing that your service cost you $12,000, you've got a deductible of $3,000. Your co-insurance is 20%. That means that's the part you pay. And your out-of-pocket maximum is $6,850. I want to see how much you guys understood what we just went over with the example. Tell me what your cost will be for this service. Okay, we got an answer. Okay. Got 1, 2, 3. Okay. So far, I'm not seeing the answer yet.
Asia, I don't know why you insist on doing math.
I gotta make people work for it. I'm gonna give the person who's closest to the answer the gift card. Okay. Okay. Anyone else want to throw it in there before we close out our? Okay. 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 Mindy, you can't participate.
Oh, is that the right answer?
I can't tell you. I'm not going to tell you, but. All
I
right.
ran out of fingers.
Going once, going twice, and then I'm going to show the answer. And Maylee, you are at okay. Rachel, Miss Rachel at 4:20 p.m. You are the last answer. Okay, so let's just see what the answer is here. The answer is 4,800. Okay, so let's break this out. What? And let me see. I saw someone put that in here. Maybe you don't count. Okay, so
I wasn't sure if I knew how to do it.
so the who will actually get this will be Jacqueline Valencia, because you have it at 5,000. And let's kind of go over this why. So remember, the service is $12,000, right? So right out of the gate, before the insurance carrier is even going to pay anything, you've got to pay $3,000 because that's your deductible. Okay. Then you pay 20% of whatever is left over. And then the which is 20% of the 9,000, which comes up to 4,800. And then insurance plan is going to pay the rest. Okay. I threw that out of pocket max piece in there to kind of see if you guys were paying attention. But does that make sense? No questions? Okay, perfect. Perfect. And then so congratulations, Veronica. Congratulations, Jacqueline. Jacqueline, make sure you send me your email address that you would like your e-gift card to go to. Okay. Yes, Norma, it is. 20% of 9,000 is 1,800, that's what we have here. So deductible 3,000 plus 1,800, that's $4,800 is that you'd pay. Okay. All right. So now that we are getting close to our close time, which is good because we are just about finished with today's session. But before we finish today's session, I really want to take just a second to help you guys with just thinking around which plan is going to be the best for you. You know, a lot of times people try to be very helpful and give you their idea and their suggestions around which plan you should select for yourself. Everyone's got their own opinions about how they've experienced one plan versus the other. And here's some things that I will definitely say you really, really, really want to make sure you're thinking about. Number one, how much coverage do you need? And does your family need? You want to make sure you think about that. So you want to be careful about choosing a plan strictly on the basis of being the cheapest or being the most expensive. Because just like you could find yourself in a situation getting a plan where you don't have enough coverage, you could find yourself in a plan paying way too much for something you don't need. So think about what amount of coverage do you need? And then will you need a plan that is, just for you, or is it going to be for your family? If you have kids, you really have to take into consideration that especially if they are, under the age of, 18, you're likely to have some random doctor's visits for a variety of different reasons. And so you want to make sure you have a plan where their co-pays to see the doctors on a regular basis aren't going to be outside of what your budget can handle. Because while you want to be able to get a good plan, you want to be able to afford those out-of-pocket costs that you're going to have to foot throughout the course of the year. And does the network have the doctors and the hospitals that you want? Well, that's kind of a given because it's a PPO. So you will likely be able to see whichever providers and doctors you want because that is the benefit of a PPO. You can see in and out of network. But just know that out of network costs are going to be a bit higher than if you see a doctor who is contracted with Blue Shield. So always check that out, which that shouldn't be a problem because the coverage is really good in your area. And then the other thing is you want to look at what are the out-of-pocket costs, such as your premiums. Of course, that's out of your paycheck. You want to think of your deductibles, co-pays, pharmacy costs. So again, what I'm going to say to you is go back to, this presentation, which will be available. Go back, start here to compare for yourself. Start here and then look at the more detailed side by side because it will show you what are your deductibles, what are going to be your co-pays, What is the coinsurance? What's the maximum amount you're going to have to pay out of pocket in a given year for both single and for family? Okay, so that might be helpful for you, is to start there and then make your way to the more detailed aspect of things. Okay, so those are some of the things where I would say it would be a really good idea for you, for your starting point, for you to start with the simple area where I break it out in just 4 different, aspects, with the deductible, the insurance copay, and the out-of-pocket max. We've already done the raffle, so we won't go there. Now, before I move on, though, actually to the resources, I just want to do a quick check to make sure no one had any questions on anything. Was there anything that we covered that wasn't clear, or maybe something that you thought was going to be covered that you did have a question on? No? Okay. All right. So resources. So what I would like to make sure I point out to you, that there is the resources page. You can actually get to this directly from the Blue Shield page, which is embedded at on the CVT website. You can also, which I don't have on here, and I probably should have put on here, and I'll embed it before I send the website out. But the link to the benefits page has all this really good information in it. Okay. There's also information on this Physmetrics, which I mentioned is for chiropractic, acupuncture, physical therapy, occupational therapy. There's also the telephone number to the benefits department, as well as the CVT customer service. And don't forget, next week, the health fair, CVT will be there, benefits will be there, I will be there, a lot of other vendors will be there. Make sure you show up and get some questions asked. Come get a raffle card, come get some good information, come get your questions answered. So good question in the chat box is, are we able to add and remove dependents at any time? No, not at any time. Typically, when you add and remove dependents, you need to do it during open enrollment, unless, of course, it is a qualifying event. And what by qualifying event, I mean you have a new child, or you adopt a child, or let's just say you have an adult dependent that falls off of your plan, or God forbid, you end up having a child that passes. Those would be times where you can add or remove a dependent throughout the year. But open enrollment is the time where you would do that. Okay. If you get married and you have a new spouse, and you inherit children through your spouse, that is considered a qualifying event. And so that would be a time when you can add them. So hopefully I answered that question, Lupita. Any other questions? All right. Well, that ends us exactly right on time. Time is about 4:29 p.m. And so we are right on time with closing out. Feel free to let me know if you have any additional questions. We'll be at the fair, but you're welcome to email me. I am putting my email address in the chat box. However, my email address will be with the actual presentation deck that Mindy is going to be sending out. And of course, Mindy is a wonderful resource for any of the questions that you might have regarding your open enrollment and benefit related questions. And thank you all for attending. We had a wonderful, wonderful turnout. Glad to see all of your faces, and we will be doing another workshop